It was Senator Rockefeller who gave me the first opportunity to speak out about the health insurance industry from my perspective as a former executive. I've been on a very remarkable journey since I testified before the Senator's Commerce, Science, and Technology Committee in 2024. About a month ago, that journey took me to a huge outdoor event in a place called Brannon, Wisconsin. And it was an event that was the 8th annual Fighting Bob Fest, which was named after legendary senator from Wisconsin, Bob Follett. Thousands of people were gathered there for a day of speeches. I encourage you to go there. It's like they call it a kind of Midwestern Chautauqua. It was a beautiful sunny day. And just again, just a month ago, you may have heard this term that is used a lot in entertainment. That you're asked to suspend disbelief when you go to the theater to see some fantastic movie because you enjoy it better. You just accept it and suspend disbelief. So I asked the people there to suspend disbelief for a few minutes. I asked them to imagine that every one of them was either uninsured or that they had insurance that had such high deductibles or limited benefits that they still couldn't afford to go to the doctor. I asked them to imagine that they had slept in cars the night before. They had lined up in the dark just before dawn to get a number that hopefully would enable them to get inside the fairground gates. I asked them to imagine that they had been waiting in long lines in the rain for hours for a chance to be treated by a doctor volunteering his or her time to help them get the medical care that they needed. I asked them to imagine that those long lines led to barns and animal stalls that other volunteers had scrubbed down and disinfected the day before. And then I told them that they didn't really have to suspend disbelief. Because that scene that I described actually happens, and it happens often in this country. And I know because I witnessed a scene like that at County Fairgrounds in Wise, Virginia, not far from here, and sort of not far from where I grew up. That was a scene that moved me so much that I eventually left my job as a spokesman for an industry that I came to realize had made it necessary for people, some of whom I knew could have been my relatives or my former neighbors, to stand in line waiting to get care in animal stalls. As I told Senator Rockefeller's committee in June, the higher up the corporate ladder I climbed, the more I could see how insurance companies confuse their customers and dump the sick, also to satisfy their Wall Street masters. I described how insurance companies make promises they have no intention of keeping, how they flout regulations designed to protect consumers, and how they make it nearly impossible to understand and often even to obtain the information that they need. I also described how the industry has conducted deceptive and well-financed PR and lobbying campaigns every time that Congress has tried to reform our healthcare system, and how its current behind-the-scenes efforts may well shape reform in a way that benefits Wall Street far more than average Americans. I noted that just as the industry did 15 years ago when it led an effort to kill the Clinton healthcare reform plan, that it was using the same allies in front groups to spread lies and disinformation to scare Americans away from the very reform that would benefit them the most. So let's make no mistake, the industry, despite its public assurances to the President and to Congress to be good faith partners in healthcare reform, the industry's been at work for years laying the groundwork for devious and often sinister campaigns to manipulate public opinion. I know because I was a part of it. Just this week, the industry released a bogus report in an attempt to persuade members of Congress to impose heavy fines on you and other Americans who don't enroll in one of their overpriced health plans. One of the reasons I left my job at Cigna, where I headed corporate communications, was because I didn't want to be involved in yet another PR and lobbying campaign to kill reform. But you can rest assured that the insurance industry is up to the same dirty tricks, using the same devious PR practices it has used for many years to kill reform this year, or if it can, to shape it so that it benefits insurance companies and their Wall Street investors far more than average Americans. I have warned over the last several months that Americans should be on the alert to how the industry and its allies are working to influence their opinions and lawmakers' votes. I know how effective insurers have been in using scare tactics to turn public opinion against any reform efforts that would threaten their profitability. And if Congress goes along with what the insurance industry wants, and if it fails to create at least a public insurance option to compete with private insurance companies, the bill that it sends to President Obama might as well be called the Insurance Industry Profit Protection and Enhancement Act. Frankly, if the Senate Finance Committee bill that reaches the President without important amendments like some that Senator Rockefeller has proposed, that's exactly what it could wind up being. It's not too late to keep the insurance companies from winning again this time, but time is running short. We need to think of the coming weeks as some of the most important weeks in the history of this country. We need to think that way because they will be, in my opinion, they will be. And we must redouble our efforts to make sure that members of Congress put our interests above those of insurance company executives who view reform as a way to make more money. So over the coming weeks, we must tell our friends and our neighbors who are worried needlessly about a government takeover of our healthcare system, to use a term the insurance industry likes to use a lot, which is not true, that what we all should really be concerned about is the Wall Street takeover that has occurred while we were not paying attention. It is that takeover that has led to more and more Americans being forced into the ranks of the uninsured. It is that takeover that has forced millions more of us into the ranks of the underinsured, because private insurance companies are making us pay thousands of dollars out of our own pockets before they'll pay a dime. It is that takeover that has forced many of our neighbors out of their homes and into bankruptcy. And it is that takeover that is causing more and more small businesses to stop offering coverage to their employees because of the unnecessarily high premiums that greedy Wall Street-driven insurance companies are charging. I want to close by once again thanking Senator Rockefeller for all he has done over the years and is certainly doing now to help fix our very badly broken healthcare system, our dysfunctional healthcare system, and to hold insurance companies accountable, and accountable not just to their Wall Street masters, but to the people they are supposed to be serving. I urge all West Virginians actually to support Senator Rockefeller in the coming weeks as he works to persuade his colleagues in Washington to do the right thing. If they don't, more and more of us will find ourselves waiting in lines to get charity care in animal stalls and barns. If they do, America will finally join the rest of the developed world in making sure that all of its citizens, our brothers and our sisters, our sons and our daughters, our neighbors and our co-workers, have the ability and the means to get the health care that we all need when we need it. So let's do our part to make sure that that happens.